A patient presents with deep, measurable physiological pathology, advanced tissue changes, and clear lab results, but offers absolutely zero distinctive mental or emotional symptoms. When you encounter a case like this, standard homeopathic workflows hit a brick wall. The cause of this bottleneck is the traditional Kentian structure. It relies heavily on a strict top-down hierarchy that always prioritizes mental generals above physical particulars. If you don't have those mental symptoms, you can't navigate the system. Dr. S.R. Phatak recognized this failure point and designed his Concise Repertory of Homeopathic Medicines as a direct post-Kentian intervention. He altered the architecture. He stripped away the anatomical sections entirely, replacing the nested hierarchy with a flat, continuous alphabetical index from A to Z. This structure removes the philosophical hurdles and turns the repertory into a rapid deployment tool for routine daily practice. Phatak engineered a pathology-first operating system. It functions exactly where classical mental-first prescribing stalls. The text began as a series of rough Marathi drafts. For 10 years, the manuscript sat untouched on Phatak's desk due to his fragile health. Eventually, his son, Dr. D.S. Phatak, along with colleagues S.L. Kapadia and Dr. Homoeopathic Merchant, organized the skeletal copy and prepared it for its first publication in 1963. The work expanded significantly in the 1977 second edition. Phatak, working with Dr. P. Sankaran, integrated new clinical and pathological symptoms sourced directly from masters like Boger, Borick, Clark, Herring, and Kent. What sets this apart is its curation filter. The list of remedies is reduced to an absolute minimum. To survive, a remedy had to be personally cured in Phatak's practice, or possess undeniable justification from classical authors. This standard of curation continued into the modern era, specifically with the additions made by Dr. D.S. Phatak in the year 2000, third edition. Every single entry in the book is pre-vetted for clinical efficiency. Practitioners are saved from sifting through unverified, theoretical remedies. Looking at the physical layout of the book, you will find a 2-column, strict alphabetical format that stretches from abdomen affections all the way to Zygomae. To use this book effectively, you have to stop trying to map symptoms to body parts first. You search for the exact alphabetical heading directly. Notice the architecture within a rubric block. The main rubric is capital bold. A sub-rubric nests below with 1 indentation in small capitals, and a sub-sub-rubric with 2 indentations. Beside these, drug strength is graded: first grade in capitals, second grade in italics, third grade in standard Roman. This specific grading mirrors Kent's established evaluation weight, providing a familiar anchor point within the otherwise flat alphabetical layout. You will also occasionally spot a plus symbol next to certain rubrics, like abdomen pain plus coffee ameliorates. This symbol marks verified modern additions introduced in the year 2000, allowing you to track the exact evolution of the text's clinical data over time. Mastering these visual cues, the indentations, grades, and symbols, is what allows the practitioner to navigate the repertory at speed, turning a simple list into a multidimensional clinical database. There is a major syntax trap unique to Phatak that you need to be aware of. The capitalization of a word alters the entire clinical meaning of a modality. If the abbreviation for aggravation or amelioration is printed in all capital letters, it represents a general modality modifying the entire systemic state. Conversely, if the abbreviation is in lowercase, it strictly confines that modality to the specific local anatomical part. Phatak applies this same syntactical precision to human urges, splitting them cleanly between the mind and the body. The rubric desires is exclusively reserved for abstract mental states. For example, you would look here for a symptom like desires more than she needs. The cravings rubric is strictly utilized for physical food and drink urges, such as cravings for alcoholic drinks or strange items. The single exception to this split is the aversions rubric, which houses both mental repulsions, like an aversion to family members, and physical food rejections, like an aversion to meat, in one consolidated place. These strict syntactical boundaries prevent case-taking errors. They force the practitioner to correctly categorize a symptom as mental, physical, general, or local before they even open the book. One of the most powerful features of Phatak's work is his inclusion of nosological, or disease-named, rubrics. In a classical workflow using Concise Repertory, practitioners must deconstruct a modern diagnosis into dozens of fragmented, individual symptoms to piece together a remedy match. Phatak bypasses this deconstruction entirely. You can look up exact modern allopathic diagnoses directly within the alphabetical index. This includes explicit pathology rubrics for conditions like beriberi, plague, and fibroids, and streptococcal infection. It also includes direct rubrics for physiological states, like high and low blood pressure, or atrophy of mammae and ovary. This approach is invaluable in contemporary practice. Patients frequently arrive with advanced allopathic pathology reports, yet lack the ability to articulate any distinct subjective sensations. By including disease names directly, Phatak created a vital bridge, allowing homeopaths to translate modern medical diagnostics immediately into a curated classical remedy selection. Let's outline the recommended step-by-step methodology for processing a case through Phatak's system. The practitioner begins by evaluating the presented case through causative, time, and postural modalities. From there, you scale up to a grand generalization of the patient's broad symptoms. Finally, the process concludes by matching the remaining characteristic particulars to Phatak's curated local rubrics. To use this tool effectively, you must understand its structural boundaries. The book lacks a full remedy index and omits the original sources for its remedies. The mental symptoms are scattered unpredictably throughout the text, and it features outdated terminology alongside notable typographical errors. Because the number of remedies per rubric is deliberately kept tiny, it is difficult to use for standard exhaustive repertorization grids. Dr. Phatak never intended this text to replace exhaustive classical repertories. It is a specialized alphabetical engine built for velocity. It is the definitive tool for when a patient's pathology is loud, their mind is silent, and you need an immediate clinical anchor.